Welcome everyone to our discussion on codeine, a medication that's used for pain relief and to suppress coughing. It's really important to dive into all the aspects, from use to precautions.
I'm all ears. So codeine is essentially a pain reliever and cough suppressant, right?
Exactly. It's used for mild to moderate pain and is also combined with other ingredients in cough and cold medications. It's available in various forms like immediate release tablets, extended release tablets, solutions, and syrups.
And if I remember correctly, the instructions mention it should be taken exactly as prescribed. There's no room for improvisation, correct?
Right on. The guidelines are very strict. Take it exactly as directed and never more than prescribed. It's super critical because codeine can be habit forming if used longer than necessary.
Yes, indeed. That makes sense, especially because the medication comes with warnings about possible addiction. It's like, if you're not careful, you could end up overusing it.
Definitely. And, another crucial point is that if you suddenly stop taking it after a prolonged period, you might experience withdrawal symptoms like restlessness, nausea, or even muscle aches. So, gradual tapering under supervision is essential.
I also read that it might cause serious breathing issues, especially in the first 24 to 72 hours or when the dose is increased. That's pretty alarming, isn't it?
Absolutely. It's a major safety concern. Codeine alters how your brain and nervous system respond to pain, but can also depress the respiratory system.
Right.
That's why healthcare providers monitor patients closely during treatment, particularly if there's any risk factor involved.
Speaking of risk factors, what about patients with pre-existing conditions like asthma or COPD?
Good point. If you have a history of respiratory issues, like asthma or lung disease, many doctors will advise against using codeine. Its potential to slow breathing can be dangerous in those cases.
Yeah, I get it. And then there's the interaction with alcohol and other substances, right? That only makes the side effects worse?
Yes, exactly. Combining codeine with alcohol or street drugs significantly increases the risk of severe side effects like extreme drowsiness, respiratory depression, and even potentially life-threatening situations. It's a clear case where caution is paramount.
I noticed the information mentioned that before taking codeine, you should inform your doctor about any history of depression or previous substance use.
That's right. It's advised to share any personal or family history of drug or alcohol abuse, even if it's just an observation. This helps the doctor assess your risk for potential misuse.
Indeed, that's crucial. Now, about the dosing. If someone misses a dose, what should they do?
Great question. Since codeine is typically taken on an as-needed basis, if you miss a dose, you simply skip it. And don't try
Yes,
to make up for it by taking a double dose later.
that seems pretty straightforward. What about dosing forms? You mentioned immediate release and extended release tablets.
Yes, for pain, the immediate release tablets are common. And if it's for cough, sometimes there are extended release formulations. The point is to follow the prescription guidelines precisely.
Absolutely. So it's really a matter of matching the medication to the condition and then being very precise with the instructions.
Exactly. And there's more. There are numerous warnings regarding side effects from headaches and dizziness to more severe symptoms like slowed breathing or even coma in extreme cases if mixed with the wrong substances.
Right, that's quite severe. I did read that some side effects can be really life-threatening, like hallucinations, severe confusion, or altered heart rates.
Spot on. And while common side effects include headache, stomach pain, and drowsiness, we must be extra cautious if you start experiencing more severe symptoms such as unusual dizziness, hallucinations, or breathing difficulties.
Yes, absolutely. And what about storage? I recall there's a strict guideline to keep the medication out of reach, especially from children.
Correct. Codeine must be stored securely and at room temperature. It should be kept away from children, and it's advised to monitor how many doses remain so you can notice if any medication goes missing.
Safety first. I'm curious though, what's the process for disposal if you have leftover or expired medication?
That's important too. The information clearly states that unused or expired codeine should be disposed of through a proper medicine take-back program.
Yeah, that makes
If you
sense.
don't have access to one, then, flushing it down the toilet is advised as a last resort, but usually it's better to use a take-back program to avoid environmental harm.
Now, I know this might sound a bit overcautious, But do you really think these strict measures are necessary? I mean, isn't it common sense to store medicines safely?
I hear what you're saying, but these measures are critical because even a slight mistake can be dangerous. Codeine, in particular, poses a high risk if ingested inadvertently, especially by children.
Yeah, I suppose that's true. And then there's the whole issue of drug interactions. Patients need to be vigilant about what other medications they are taking, including herbal supplements like St. John's wort.
Absolutely, yes. Mixing codeine with certain medications can increase the risk of serious side effects. Before starting codeine, you should provide your doctor with a full list of any other medications or supplements you're taking.
That's essential. Speaking of interactions, what about the effect of grapefruit? I read there were instructions about avoiding grapefruit juice.
Right. It's advised to check with your doctor about consuming grapefruit or grapefruit juice while on codeine. Grapefruit can interfere with the way some medications are metabolized, potentially leading to increased side effects.
Yeah, that's interesting. And then there's the emergency aspect. If someone overdoses, there's a protocol involving naloxone, correct?
Yes, exactly. In case of overdose, immediate action is required. You need to call poison control or emergency services. Plus, having naloxone readily available is a safety net, since it can reverse the effects of an overdose.
Indeed. It's almost like having a backup plan, a bit like carrying an umbrella when you're not sure if it'll rain. But this is truly a life-saving measure.
That's a perfect analogy. Really spot on. And just to add, any families or caregivers must know how to identify overdose symptoms such as slow breathing, extreme drowsiness, or unresponsiveness. It's all about being prepared.
Right, absolutely. It seems like the overall message is that while codeine is a powerful tool for pain and cough relief, its potential risks, from addiction to life-threatening side effects, mean it has to be managed with extreme caution.
Precisely. And I must highlight that it's crucial to keep up with all appointments, lab tests, and ongoing communication with your healthcare provider to ensure safe and effective use.
Definitely. Before we wrap up, any final thoughts on codeine that our listeners should take home?
Just that, while codeine can be very effective when used properly, it demands respect for its potential for abuse, serious side effects, and the need for careful oversight and dosing. Always consult your healthcare provider, stay informed, and never take shortcuts with it.
Right, absolutely. Thanks for that detailed walkthrough. It's been an enlightening discussion with lots of critical info that could really help someone make informed decisions about their medications.
Exactly. Stay safe, follow your prescription guidelines, and don't hesitate to ask questions if anything seems off.
Yes, indeed. Well, that's all for today's conversation. Thanks for the insights on codeine and all its complexities.
Thanks for joining, everyone, and remember, medication safety is no joke. Until next time.